naturang nagpositibo sa ENCOM at saan-saan siya nakarating sa ating bansa.
Isang Chinese ang kauna-unahang person under investigation na nagpositibo sa 2019 novel coronavirus dito sa Pilipinas.
Land, domestic air, and domestic sea travel to and from Metro Manila shall be suspended beginning March 15, 2020.
According to the World Health Organization, COVID-19 is an infectious disease caused by a newly discovered strain of coronavirus, a type of virus known to cause respiratory infection in humans. The new disease had caused many adults and children to feel fear and anxiety. Due to the continuous increase of confirmed cases, public health actions such as social distancing had been made. This made the people feel isolated and alone. It also increased stress and anxiety. Many adults are also reporting specific negative impacts on their mental health and well-being, such as difficulty of sleeping or eating, increases in alcohol consumption or substance use, and worsening chronic conditions due to worry and stress over the coronavirus. The National Center for Mental Health's hotline saw an alarming spike of calls in the midst of COVID-19 pandemic, including a monthly average of 53 suicide-related concerns. There are different mental illness that a person can get from having a poor mental health: depression, anxiety, cabin fever, separation anxiety disorder, obsessive-compulsive disorder, and stress response syndromes. These are some of the mental illness caused by poor mental health. This mental illness can affect a person's physical health. According to a study that hit the headline earlier this year, discovered that there was a link between high level of mental distress and an increased risk of dying from cancer. This just shows that physical health and mental health are equal in terms of importance.
Mental health is just as important as physical health. It's a major part of our life. It influences how we think, feel, and behave in our daily life. It also affects how we cope up with stress, overcome challenges, and recover from life setbacks and hardship. This is the reason we people need to have a good mental health, especially now during the pandemic where everyone needs to have a good mental health and physical health to survive. These are the ways how to cope up during the pandemic. Talk about your feelings. It can help you stay in good mental health and deal with times when you feel troubled. Be active. Regular exercise can boost your self-esteem and can help you concentrate, sleep, and feel better. Eat properly. Your brain needs a mix of nutrients in order to stay healthy and function well, just like the other organs in your body. Keep in touch. There's nothing better than catching up with someone face to face, but that's not always possible. You can also give them a call, drop them a note, or chat to them online instead. Take a break. A few minutes can be enough to distress you. Give yourself some me time. Do something you're good at. Enjoying yourself can help beat stress. Ask for help. None of us are superhuman. We'll sometimes get tired or overwhelmed by how we feel or when things don't go to plan. If things are getting too much for you, you feel you can cope up, ask for help. Your friends or family may be able to offer practical help or a listening ear. Local services are there for you. If you are in need of mental health support, please call the 24/7 National Center for Mental Health Crisis Hotline at 0917-899-8727 or 027-989-8727 or 1553.
Let's fight this pandemic
Together,
Always remember
that you are not
alone.